It's time now for French Connections, our weekly look at the intricacies of French life with Florence Villeminot. Hi, Flo.
Hi, Jeannie.
Now, many viewers have been expressing curiosity, interest, intrigue about France's healthcare system. It's a system that's been ranked among the best in the world.
That's right. French people are really proud of their healthcare system, which was crowned best system in the world by the World Health Organization in the year 2000. Now, the publicly funded system is actually quite similar to a lot of other European systems, whether it's in Belgium, the UK, or Germany, but it tends to be an object of international fascination, particularly in the United States during the whole Affordable Care Act debate. The French system came up time and time again as an example or perhaps a counterexample. And actually, just last month, the very prestigious New England Journal of Medicine published this article you can see right here, applauding the quality and generosity of the French healthcare system.
Now, the healthcare system here in France isn't just generous, it's very wide-ranging.
That's right. The French healthcare system is universal, which means that it covers all legal residents. In fact, any resident over the age of 16 has one of these. This is called a carte vitale. It's a health ID card, which has actually really come to symbolize French healthcare, which is known as assurance maladie here in France. It's really easy to use. Essentially, this is a big close-up of my card, you can see. You go to any point of care and you swipe it, and it contains details about your rights to medical treatment and refunds, which are really generous here in France. The government essentially refunds about 70% of most healthcare costs and 100% of fees for serious or chronic illnesses such as cancer or AIDS. And this is really a crucial part of the French healthcare insurance system is solidarity. The more sick someone becomes, the less they pay.
But the truth of the matter is French healthcare isn't as expensive as in other countries, particularly when it comes to drugs as well.
That's right. That's because the government actually participates in setting what it considers fair prices for appointments, procedures, and prescription drugs. And since it covers the whole population, it has a lot of bargaining power to keep prices pretty low. Let's take a look at the cost of visiting a general practitioner here in France. Ever since January 2016, it's been 23 euros, which is pretty cheap compared to other countries.
Yeah, I'd say it's up to 10 times more in some other countries. But regardless, there are still a lot of French citizens who sign up for complimentary private health insurance on top of that. But with that, they can get a reimbursement, often up to 100%.
That's right. 85% of French people have private medical insurance. It's called a mutuelle here in France. It's actually our word du jour here on French Connections. You shouldn't confuse it with the money market mutual saving fund you might find in the U.S. It costs about 54 euros a month on average. And if you've spent any time in France, you've probably heard people talking about their mutuelles. In fact, the market for private insurance is so competitive that there are advertisements for mutuelles all the time. In fact, if you go to a movie, you'll probably see a couple of these advertisements. And since competition is fierce, the jingles are quite interesting. They tend to have quite catchy jingles. Let's take a listen to a couple of them.
Maïf, assureur militant.
Zéro blabla, MMA. Efficace et pas cher. C'est la meuf que je préfère. C'est la meuf.
And these really do stay in your head all day long, it must be said. But essentially, the reputation of France as having a completely socialized system is pretty wrong. It's actually a hybrid system between public and private that is very advantageous for patients. Let's listen to a pharmacist talk to us about these advantages.
Here we have a prescription for 55 euros. National health insurance covers 34 euros. Private insurance covers 21. The patient doesn't pay a thing. A customer can go to a pharmacy and leave with a full bag without spending a single euro.
Right, so if people effectively don't have to pay for healthcare, or at least very little, who's actually paying for it?
Well, the system is financed by taxation and participation by employers and employees. Let's take an example, for instance. If you have a 100 euro salary, well, on average, employers will contribute an extra 12.8 euros towards healthcare, and employees, you can see here, will contribute 75 cents from their salary. So essentially, employers and employees pump a lot into the system, but they also get a lot back from the system.
Indeed, but in recent years, the system has been struggling to stay afloat.
That's right. Rising unemployment and an aging population means that less money is being pumped into the system. And also, spending is very high in France. France spends a lot on health care. In fact, France is known, for instance, to spend a lot on prescription drugs, for instance. Doctors prescribe drugs quite a lot, and French people are one of the highest consumers in prescription drugs, particularly antidepressants, just to note that. But what's interesting is France spends a lot more than its neighbors. Let's take a look at the figures from 2013. France spent 11.7% of GDP on health care. You can see Germany is 11.3, Belgium 11.2, the UK a lot lower, 9.1, but you can see the US still a lot higher at 17.1% of GDP on healthcare.
Now, back here in France, of course, the government has put in a series of measures to try and cut spending, but it's still facing a massive deficit.
That's right. The figures are pretty extravagant. Let's take a look at the forecast for 2015 by the Ministry of Health. You can see the health deficit is forecast to be 6.9 billion euros in 2015. So that's a huge amount. And in fact, that's the lion's share of something known as the trou de la sécu here in France. Essentially, it's the massive deficit for France's wide-ranging social protection program that's called Sécurité sociale. Now, you can translate that as social security, but it's a lot more wide-ranging. It covers, of course, healthcare, but also pensions, etc., and very generous family subsidies. I'll tell you more about Sécurité sociale in another French Connections because it's a big deal here in France, and it's something that French people are very attached to. Let's listen to a couple of people.
It's an extraordinary system, even if we take advantage of it a little bit.
But we're so lucky it exists. We're lucky to live in a country with social security.
And that really touches on a very important point, and that is, though, even though it costs the state a lot of money, this very generous system is something that French people are very attached to. French people are very much attached to their healthcare system, and especially the philosophy behind it. Whether you're rich or you're poor, you won't drown in medical bills, and you'll actually get really good health care. I guess you could sum it up by saying that France has a very low mortality rate and very high consumer satisfaction.
It sure does. I will never forget walking out of 5 days in a hospital in a private room after my child was born and not paying a cent.
There you have it.
Incredible. Thank you so much, Florence Villemin. Don't forget, if you have any questions about France or the French and you'd like us to explore them here in French Connections, feel free to tweet Flo. It's at Flo Villeminot. You can also check out our website, france24.com.